Good morning, everyone. This is Ellie Jones. I'm with the California Department of Social Services, and I'll be your presenter today for the Continuum of Care Reform webinar. First, I'd like to thank everybody for making yourselves available on this Friday before a long weekend. I know it was kind of short notice, but what we're trying to do is to establish kind of a baseline of information for folks as we begin to kick off this next phase of our reform. My hope is that as you've received the information that has been channeled out from Greg Rose, our Deputy Director, and from our Director's Office, Mr. Lightbourne, that you've all taken an opportunity to kind of peruse the information and have at least started to become somewhat familiar with it. The purpose today for this webinar is really twofold. What we'd like to do is to get folks ready for the September 6th workgroup meeting. And essentially that is to give you guys the background information that we feel that you may need, since some of you may have not been involved in all of the prior work, have been involved in some of the prior work, or have never been involved in any of the prior work. So we're seeking to establish baselines of information so that as we come together on the 6th, we're able to kind of pick up some steam and get going. We are seeking also to ensure that you have sufficient information to make some decisions about where you feel that your skill sets and your interests can best serve this reform effort. So we're looking to you as participants to start thinking about the selection of the work group that best fits your areas of expertise. And then lastly, one of the things that we're looking to do is to provide you with the next steps, where we're going, what to expect on the 6th, and then from there on out. We want to start with providing some background information about where we've been. You know, congregate care reform, continuum of care reform, foster care reform has been an activity that has been ongoing in the state for the last 20 years. Those efforts have taken a number of different avenues. So what we want to do is we want to kind of start talking about the 1990 efforts. That was one of the most recent, I guess you can say that, 22 years ago. Significant efforts in our system. In 1990, Senate Bill 370 actually mandated this department to implement a new funding and accountability system for group home providers. The system included a new rate classification structure and also provides for program and fiscal audits, performance standards, and essentially tried to standardize the rate setting system. Prior to this legislation, each county was responsible for creating their own rate structure with their providers through a negotiated process. In 1993, Assembly Bill 1193 was passed, and what this did is it placed a new emphasis on the role of group home providers, specifically for those who serve children under the age of 6. This legislation was designed to limit the length of time any child that was 6 years or younger would have into a group home stay. In 1998, another large piece of legislation was passed. It was Senate Bill 933. Again, this legislation required the department, in conjunction with stakeholders, to re-examine the role of group care in family-based systems. The vision for this project was that foster care children who were placed in group home care would have their needs matched with their services, and that we would provide more accountability for positive outcomes for children and families. Another offshoot of this legislation was that we expanded as a department group home oversight and the certification for out-of-state group home facilities. So thus far what we've seen is we've got a new rate structure that established in 1990. We've got a little bit of reform that focuses for our very young children that occurred in 1993. And now we've got more of a service-based system looking at the needs of the youth and the services that the providers have, or that are offering, to try and do the best job matching them. A little bit of time elapses before the next big piece of legislation is passed. That occurred in 2007, and it was through the passage of Assembly Bill 1453. That piece of legislation required the department, in conjunction with stakeholders, to initiate the residentially based services pilot. This is a pilot that's still ongoing. It was a 5-year demonstration pilot that is designed to transform the state's current system of long-term foster care, group home care, into a system of RBS programs. What we're seeking to accomplish through this pilot, or this demonstration project, is to reduce the length of time that youth spend in group care through improvement of permanency outcomes by combining short-term residentially based services and treatment that would follow the youth through their process of either stepping down or changing placements. So we're establishing permanent connections for these youth as they move through our system. In 2011, we actually had some work that was done in conjunction with Casey Family and Sierra Health Foundation. That's one of our foundational documents that many of you have received in the emails that had been sent out. This was our Congregate Care Reform Integration Committee report. And it was developed along with a number of stakeholders across not only the state departments, but across the continuum of care, providers and advocates, youth, and philanthropy. And they developed a set of recommendations to provide the roadmap for how we are to proceed with the work that we are getting ready to launch into. And then lastly, in 2012, actually essentially in June of this year, the legislature passed a piece of legislation that established the goals and some of the activities and timeframes for this effort. So Senate Bill 1013, many of you who are familiar with this piece of legislation also know it as the Child Welfare Services Realignment Trailer Bill. But this is a piece of legislation that has the congregate care work that has been identified in it. I believe that many of you have received the statutory references that were amended through this legislation and some of the other information that was previously sent. So that's our historical piece. As you see, we've been working on pieces of reform for our foster care system since 1990. And here we are, 22 years later, still working on trying to develop an integrated system. And that's part of the reason that we wanted to take a minute to kind of get everybody baseline so that you understand where we've been and how we've looked at it. We've really been seeking to address pieces of the system, whether it's rate reform, services and needs, assessments, and pilots and demonstrations. And so a lot of what you'll be seeing as we move forward is our attempts to integrate these efforts. One of the ways that we're seeking to kind of, I guess, conceptualize the activities that have been ongoing probably more recently that some of you have been involved with is to look at it through three different lenses. We have the administrative category, we have a funding category, and we have a program category. And through the administrative process, there were two things that really have been influential in the child welfare program that have been established at the statewide level. The first would be the California Child Welfare Council. This is a statewide advisory body that provides recommendations to improve the child welfare services program, whether they be outcomes or program, through increased collaboration among not only programs, including the Department of Health Care Services, Department of Mental Health, Departments of Alcohol and Drug, as well as the courts. We also work with our advocates and our youth and our parents through those work, and they advise our Secretary Dooley and provide structure to some of the reform efforts that are we're currently undergoing here in California. The other advisory body or administrative body that the department really relies on is our State Interagency Team for Children, Youth, and Families. The statewide interagency team, otherwise known as the SIT, was established here at the Department of Social Services probably about 8 years ago. And again, it's designed to provide leadership to align planning, funding, and policy across the state departments. So you have the Child Welfare Council, that's the broader group, and then you have the statewide interagency team that is more focused on specific policies and areas for planning. If we move into the funding reform activities, one of the big ones that many of us have heard about for the last number of years is the Title 4E waiver, also known as the Capped Allocation Waiver, the 4E Demonstration Project. It currently is operational in Alameda and Los Angeles counties. The 4E waiver is designed to provide a capped allocation of the federal dollars that are used for foster care maintenance and administration, and allows counties, those two counties, the flexibility to use those funds to best provide the service needs for the children involved in their child welfare system. The goal of this is to provide through this flexibility that we will improve the array of services for children and families, essentially improving their child welfare and well-being and promoting better outcomes for them. The next piece that we've worked on is the Intensive Treatment Foster Care Multidimensional Treatment Foster Care Work Group. Now these are activities that have been ongoing in the state for the last couple of years. The primary level of care, I guess one could say, that we've been focusing on here is our foster family agencies. And the goal is to expand and serve children who, with a different array of services, who would have otherwise been in group home levels at the 9 through 11, so in our upper level group homes, to try and keep them at the foster family agency in a lower, more family-based setting and provide them with appropriate services to keep them in a family-based setting. The other thing that this does is the multidimensional treatment foster care utilizes the evidence-based service model. So together we've blended the foster family agencies, the support for our foster care providers, and temporary rate increases to try and better align our services. These activities are very critical to some of the other work that we'll talk about in a few minutes, specific with our KDA implementation programs. The next activity that we've been working on in our funding reform has to do with a waiver that was granted to a provider known as the Boys Republic. This is a provider that is currently being reimbursed through the waiver at a higher level than the level that they were originally established at. And the goal is to promote, again, positive outcomes for the youth that are involved with that project. The waiver itself waives some of the formal requirements that we normally have for the higher level care around graduate education requirements and some of the other rate requirements. So we're able to do flexible funding for this program. We've also been under other various influencing factors specific to lawsuits in our funding structures that have required increases in services or increases in funding for service providers. Group home lawsuits, we've also had our foster family home lawsuit. So those are also influencing funding activities for this department. As we move into the next slide, you'll hear a lot of familiar terms that many of you either are currently involved with or have been previously involved with. Specifically the program activities. In this area, we have focused, well actually what we'd like to do is just kind of highlight some of the big ticket items for us. Specifically the Wraparound Services Program. Wraparound has been an activity that the state has been involved with our counties for a number of years. This program is designed to provide intensive services to support the child and family as an alternative to group care. So to the degree we can provide support services to families either in the foster family agency or in a family home to keep that youth from moving into group home care, that's what this is designed to do. It provides 24-hour crisis intervention services. It's a coordinated care model with intensive home-based services for the youth and the family, and provides really a facilitated process for services to be identified and linked. We talked a little bit earlier about our residentially based services program. That program is currently being piloted in 4 counties. That would include Sacramento, Los Angeles, San Bernardino, and San Francisco. Through this initiative, the department and the counties are seeking to test alternative program and funding models to transform our current group home process. It combines short-term services and treatment options through the communities to reconnect youth with their families. What you will see with this is if a youth has been, for instance, if a youth has been placed in a group home and is an RBS client, that group home staff will be their ongoing connection or their term connection that they will have through their step-down process. The system itself previously had changes in the support services or in the providers every time a youth made a change in placement. Through RBS, we're seeking to establish those continued connections as they move through our system. We're getting some static on the line at this point. If you guys could try and mute your phones, that would be great. The next programmatic reform we'd like to talk about is our KDA program. This is a lawsuit that was recently settled between the department and a number of providers. It's a settlement that involves the delivery of medically necessary mental health treatment services and other integrated services to children at risk of placement into the foster care system. The primary focus here is on Medicaid-eligible children. And again, the settlement offers us to continue our partnership to excuse me, if you could mute your phone, that would be great. We're getting some feedback. Thank you. It is in partnership with these providers as well as the county and probation staff that we seek to improve the quality of services delivered using a core practice model that is in the process of being fleshed out. The Department of Social Services and the Department of Healthcare Services are in the process of establishing a joint governance structure that will ensure that quality services, mental health services, are provided timely. This activity is important for all of us as we start this process of reform, because there's a lot of work that has been done through the KDA settlement process that will be used by these groups to better inform us as we move forward. The CAP process, or the California Partners for Permanency program, is a 5-year federally funded pilot that is currently in Fresno, Humboldt, Santa Clara, and Los Angeles counties. It is designed to initially focus on the Native American and African American populations who have been in foster care for 3 years or longer. The project right now is seeking to expand it to include all youth over time and to expand it beyond those 4 counties. The project is designed to develop and implement an integrated casework model, again, utilizing family finding engagement, team decision-making, integrated mental health and behavioral health processes, and again, post-permanency supports, with the emphasis on the importance of creating change throughout an organization and to improve the practices of our child welfare and probation staff to promote better outcomes for children. Family finding engagement is an activity that I just mentioned. This is a method or a strategy that we have utilized in California for a number of years, and its goal is to increase the connections that our youth and our family members have by establishing lifelong relationships. This involves looking into the case files, identifying relatives or other kin that the children and youth may be aware of, and reaching out to them and trying to reestablish those connections. Many of you are familiar with this next project. We know it as the After 18 program. You may know it as AB 12. This is a program that we have implemented in California effective January 1st of 2012. And it's designed to allow youth to remain in care and to continue to receive foster care benefits and services beyond the age of 18. This program will continue to provide resources and services so that all of these youth will successfully transition to adulthood. Well, all these things are good. Are they enough? And that's the question that we are here to answer. What's missing? What's missing for us is that we haven't really looked at how we can best integrate all of these services. With the programmatic pieces that we had just touched on, we talked about the integration of mental health treatment services, maybe the ongoing connections with our providers and our youth, or our providers and our families. We've also talked about the need for leveraging of funding, but they've been done in pieces. Through this effort, we seek to integrate all of these systems of care. From leveraging the existing efforts, we will build from these initiatives in developing the new system. What we seek to do is to create change that will improve the quality of care for youth and families. Change that will promote coordinated services and integration of those services so that they appear seamless to the youth and the families. We're seeking to leverage funding to support the array of services that our families need. We're also seeking to ensure an active family and youth voice and choice in these processes. And it's essentially promoting ongoing engagement by the clients that are receiving these services. And finally, we're seeking to establish mutual accountability across all the systems and all of the agencies. One of the things that we seek to do through this is to promote safety, permanency, and well-being for all of our families. Specifically, improved educational outcomes and educational stability through continuous family finding and engagement. And also, we want to develop the mechanisms for determining and addressing youth satisfaction and quality of services. So the question now becomes, how are we going to get there? Through the Continuum of Care reform, the department, in partnership with the County Welfare Directors Association, our county representatives, our foster youth, our advocates and providers, will begin the activities necessary to achieve the new system of care. As a foundation for this work, we're going to be utilizing the Framework for Integration of Congregate Care Reform Efforts in California. It was the report that we had referenced earlier that was developed in 2010 with Casey Family and Stewart in partnership with Sierra Health Foundation. Through that process, they reviewed 13 different initiatives, some of which we had previously discussed, and they developed a set of recommendations on how to best integrate this work. So we're going to be using this as our framework for launching this next phase of our efforts. The recent legislation also provides the goals, the activities, and the time frames for the work. Some key milestones that folks should be aware of is that in December of 2013, this department, along with you, will develop a detailed action plan that will identify implementation activities that have already been accomplished or are under construction, and then recommendations for the legislature if necessary. We need to recognize that this effort is not something to be taken lightly. It is a significant effort, and that the department will continue to mobilize the staff necessary to have its success. Currently, we have actively involved and actively engaged in this effort staff from the Children and Family Services Division, our Administration Division, our Community Care Licensing Division, and our Legal Division. And we will be seeking to use our own resources along with the information you bring to the table to best complete this work. Okay, so let me pause here and see if there are any questions. Okay, we haven't received any questions through the chat, and we don't have. Is there any questions from anybody on the phone for any of the information that we previously covered?
Hello, hi. This is Liz Crudo from San Francisco, and I just got the information that the number was changed, but I'm not able to get into the actual webinar PowerPoint. Okay. Is that not available anymore?
You know what, Liz? We will send that to you directly.
Okay. Thanks.
Okay.
This is Shelby Boston in Butte. Could I have that sent to me as well? I'm not able to see anything that you're reading from.
Sure. What we'll do for the folks on the line, there will be two activities that will take place. One is we're in the process of posting this information on our department's website. Under the Children's Division, you will actually see a link that speaks to the Continuum of Care Reform. We will put this there, and then we will also send this out to everybody who has been receiving these emails. So let's talk a little bit about our next steps.
Hi, Ellie. This is Judy from Ventura.
Hi, Judy.
Hi. I'm sitting here thinking, you know, I'm very excited about this, but I can't help but think about the need to engage mental health, given that so many of these programs rely on EPSDT funding. So, is there efforts on the part of CDSS admin and/or CWDA leadership to engage mental health?
Yes. We actually have already reached out to the County Mental Health Directors Association and to the State Department of Healthcare Services.
Great, thank you. I joined late, so I might have
That's
missed
okay.
it if you mentioned
We
it.
actually didn't talk about the work group membership. There's a lot of that will be discussed on the 6th, which actually is a great segue into where we're going as far as the reform meeting that's scheduled for next week.
Okay.
For those of you who hadn't already received it, and I know a number of you may have received the notice late, and I apologize for that, we are actually having our kickoff meeting next week on the 6th from 10 a.m. to 2 p.m. here in Sacramento. We will make the information available not only online, but I believe that we're in the process of securing another webinar so that you can see the PowerPoint presentation and hear the information from Director Lightbourne and Frank Mecca, the Executive Director of CWDA, as well as our very own Greg Rhodes. So we've got a cast of characters that we'll be presenting on the 6th. We will also work to identify the conference call-in lines for each of the subcommittees so that those folks who are not able to travel can participate. So the 6th is our very first kickoff. This is going to be a working meeting. In the morning, we will structure it to provide an overview of the expectations, the vision, and the goals from the director and from the counties. And then we are actually going to be breaking into work groups. There will be 3 separate work groups that will be established, one of which will be our program work group, which will be designed really to look at the integration of the services and the assessment of the needs of the youth. We'll be looking at a data work group. For those of you who've actually had an opportunity to read the legislation for congregate care reform, we are required under that legislation to establish performance outcomes and to identify, to promote positive outcomes, what those outcomes would be for the youth in these programs. And then we also have a fiscal work group that will continue the work that we've started through the prior congregate care reform. So at this point, there will be those 3 work groups. What we would be asking you to do is to identify which work group you think you would best provide information to or best use your subject matter expertise to help inform. We have a number of stakeholders that will be participating, and we would expect to have a very healthy discussion around where we want to go with this process. So that's really where we're going. This is, as I think you've heard Liz or Judy or even Shelby say, this is a big project, and for many of us, this is going to be a legacy project where we're going to spend a number of years working to amend the system. As you had heard from the historical information we had discussed, the last time we looked at the restructuring of the rates was in 1990. So 22 years later, we're looking at how we want to do it to better inform and to continuously improve the services that are providing to our children and families. So I'm looking forward to it. I think we're going to have a lot of fun, and we're going to learn a lot from each other. So I look forward to seeing you all next week, if not hearing from you. And if you have any further questions, if you could email me, or actually email Alita first, and she'll funnel them through. For those of you who are not seeing it on your screens, Alita Prudhomme is our departmental contact. It's aleta.prudhome at dss.ca.gov. It's MME, so prudhomme at dss.ca.gov. The other thing that I want to let you know is for Alita, she's taking count of those of you who are interested in buying the box lunch, which is $7.50. We need to get our counts into our vendor. So if you could round back with her and let her know that you're interested, that would be great. Otherwise, I would like to say thank you for everybody for participating. We're going to take one more pause for questions.
Yeah, hi, this is Barry in San Diego. I just missed, I heard you say 3 work groups, but I only wrote down 2. I think I missed one. I know you use program and outcomes and...
So program, data, and fiscal.
And fiscal? Okay.
Fiscal, yes.
Okay.
Okay, we have a question here in the room.
If the plan is in the law, if the plan is to be developed by September 2013, is there like an implementation date?
So the question is if there's a plan, if there's a requirement for a report, is there a plan for implementation? And that will be part of the work that we'll be doing through this effort. So we will have, the goal of this process is if there's something that we can implement, that we will do it along the way. And then what recommendations may need legislative change, we'll need to put that together. So this is, again, this is a fluid process. There's no concrete end that as of 2015 we're done. This is an ongoing effort, and it will probably take many years, but we are all committed to making this work and to developing a process that will serve our youth for many, many years to come. Any other questions? Okay, again, thank you all for participating. We look forward to seeing you next week on the 6th, and I hope you have a wonderful Labor Day weekend.
Thank you.
Thanks. Bye-bye.